Hello, my name is Tom, and I want to let you know about how my experience here with the Milford Vascular Center has gone over the last few years. Let's go back to the beginning when everything had started. I had some bruises on both of my lower legs, mostly like in the shin area, calf area, that just were not healing. And my primary physician had suggested I probably had what's called venous insufficiency and recommended that I work with a vascular center. Prior to coming here, I was working with the wound center at Milford Hospital for an open wound that I had that wouldn't heal. And after working with them, the wound had healed and we were fine. And we had done the radial ablation here at the Milford Vascular Center. They do work in conjunction a lot with the wound center. So we did the radial ablation in both legs. Unfortunately for me, I hit the wound again in the exact same spot where it had healed and it had reopened. So we were working here, and I've been working with Aaron Orozco here for the last 2.5, 3 years on a regular basis. We did the ablation, and then we did several more foam injections to try to get things, going. I'm finding personally that working here with the vascular center, as far as my wound treatment, was working better than working with the wound center itself. Nothing against them, but I'm finding here smaller staff, a little more involved, and their direct treatment. And working with Erin, she tries to find anything. What could it be? Could be this, could be this. So we worked on different things. So what we were working on over the last couple of years, and unfortunately, but fortunately for me, while we were working on the different injections to get the circulation back in the leg, my leg had ulcered. The wound that I had hit and reopened had ulcered again, unfortunately. So fortunately, since I'm working with Erin already anyway, we come in, she looked right at it, she knew exactly what we needed to do. So all different kinds of treatments and more foam injections, and there were a few things also that we decided to try. We tried the, I think we call it a wound vac, where it's a vacuum that goes right on the wound, which is a lot better than having to go all the way back to the wound center and use I think they call a hyperbaric chamber. It's like a super high pressure thing, which is supposed to heal the wound, but the wound vac is much more convenient and a lot less painful. Again, credit to Erin, because it was her idea. And again, working with my insurance company to get it covered and to get it to where we needed to get. Most recently, we decided to try this, I don't remember the name of the procedure, but essentially it's a skin graft where the material is made from a pig liver and it goes into the wound and it's supposed to help accelerate the healing of the wound. Again, credit to the staff here, because they will just try, okay, we tried this, that worked, let's try this, that. Everything they tried just kept working a little more and a little more. This one, however, really seemed to accelerate everything. We started it 2 weeks ago. The wound is not as deep as it was. It's much more shallow. Beautiful pink skin coming in. It's finally, I'm like, thank God I can finally, function again. The nerve pain that I used to have in my left leg prior to us figuring out what was going on is now just localized to the one little area, just right to the shins. But that's mostly probably because the compression that we have to wear after we put these things on, the compression kind of presses on the nerves a little bit. But you know what? Suck it up, and you deal with it and you move on, because I know that what she's recommending is going to work. So we're working on that. What's great here is whenever you try to, when you do try to schedule something, they're great at working into your schedule. Sometimes, Erin's here later on certain days, earlier on other days, and it just works out that with my work schedule and when I can meet up with her, you come in, the staff is ready for you right away. You're not sitting here for an hour in the lobby. In 3 years I've been coming here, not once have I ever not waited more than 10 minutes. If your time is, this is your time, and they're a lot of times earlier, they'll just bring you right in. So you're not stuck up, which is great, because I know that's frustrating to a lot of, because you're sitting out there and now you're stressed and your blood pressure is higher, the whole thing. You're very relaxed when you're here, because the outside lobby is also very relaxing. Listen, I see a few people. I got one colleague of mine that's out there too, and his legs, I don't know, I keep telling him, listen, you should go. At least just go to a vascular center, get a consultation, and just find out what's going on before a lot of things are too late. Because the way I see his legs, it's the black, and the pain that he must be in, but he just deals with it. And I'm like, but if you just went, you can get a treatment, just a few injections. Yeah, it's over the course of a few years and it's an inconvenience, but you know what? You don't want to be 80 and you can't walk because you have so much pain in your legs you can't move. So get it while you're still young, and then later on you're doing good. But yeah, the staff here is excellent. They really work with you. The follow through on a lot of things. Even after hours, I had one issue where the vacuum one time wasn't working properly and I wasn't sure what to do. And it was a Saturday morning, 9 o'clock, and I had called, and Dr. Esposito himself returned that phone call to me and said, yes, no problem, here's what you do, done, good, okay. So it was fantastic. I'm really happy working here. They're great.
If you have venous insufficiency and wounds that don't heal, it's important to be seen by a vascular specialist as soon as possible. Here at Milford Vascular Institute, our vascular specialists treat venous insufficiency using state-of-the-art, minimally invasive techniques performed right here in our office. We also provide the most advanced wound care available anywhere to help heal your non-healing wounds. To schedule a consultation with one of our vascular specialists, give us a call today at 203-418-7386, and it will be our pleasure to care for you.